Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon. Welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are here live in the studio on Awesome Radio 107.5, FM. And we are so glad to be here with you on today. And I'm so glad to have you here. We're here every Thursday from 3 to 3:30 on Awesome Radio. And you can also join us on Awesome Radio Facebook and YouTube. All right, we're going to jump right in. I'm so glad to have in our studio, well, live with me from her office, Dr. Sharona Johnson. Hello, Dr. Johnson.
Hey, Miss Bridges, how's it going?
Ah, I can't hear you.
You can't hear me.
There we go. Okay. Turn it up just a little bit more.
Let's see.
Well, while she's getting her microphone straightened out, our subject today, our topic today is going to be understanding kidney disease. Now, Dr. Johnson is a nurse practitioner, a family nurse practitioner. She is a specialist in nephrology, and she just has a wonderful background in kidney disease and understanding the kidney. So let's try it again, Dr. Johnson. Can you hear me?
I can, but I think I'm having some technical issues here. Hold on. Are you able to see and hear me now?
Okay, well, we're working on your sound. I can't hear you. I can't hear you well.
You can't.
So can you turn your sound up? I'm gonna let you keep practice seeing what we can do with that. But we're gonna talk about kidney disease and we're gonna just look at a little bit about what kidney disease is also known as renal disease. And it refers to a group of conditions that damage the kidney or causes the kidney not to function of the way it should, because the kidneys is what we use to filter our blood. And so we're going to keep on going and talking. I don't know, Dr. Johnson, try to get back on there with me again in just a few minutes. So we'll see where she is. But let's talk a little bit about the common causes of kidney disease. You have diabetes is a common cause, high blood pressure or hypertension, heart disease, infectious diseases sometimes, and sometimes there's even genetic disorders that can cause kidney disease. And you have a couple of types of kidney disease. You can have chronic kidney disease, or you can have acute kidney injury or end-stage renal disease. So let's talk a little bit about the types, okay? The chronic kidney disease is usually a long-term condition where the kidney has been damaged progressively or gradually over time. So all right, there she is. Okay. All
Are
right,
you are you able to hear
Dr.
me
Johnson,
now?
we're talking about the types of kidney disease. You may have been able to hear me.
I
So
was.
we're just looking at the three types: the chronic kidney disease, the acute kidney injury, and I was just getting ready to talk about the end-stage renal disease. So I'm going to let you, as the specialist, jump back in and um, let's talk about the end stage, and then I'm going to give you a chance to tell us a little bit about yourself and why you are a specialist. Okay?
Are you able to hear me now?
Oh,
You still can't hear me?
can't hear you.
I don't.
Okay, well, try to go off and come back again. So we're gonna get this. The devil is just mad because we have some good information that we need to share. So, but we're gonna get it straight. But let's talk about what I was getting ready to talk about: end-stage renal disease. And end-stage renal disease is the most severe stage of kidney disease, where the kidney have lost almost all its complete function to be able to filter any of our blood that we have coming through our bodies. But the acute kidney injury, That's an injury of the kidneys that occurs suddenly. It can be cause of a trauma, an acute disease process that you've had, but it's most of the time it's temporary, but it can turn into chronic kidney disease, but it is acute. So acute means that it happens quickly and is something that happens like within the first couple of hours. But chronic is an extended period of time where you have had different disease processes that has caused damage to your kidneys over the time. So you ask, well, okay, if I'm having some type of kidney disease, how do I know that I'm having kidney disease, or is there any symptoms? Sometimes there's not any symptoms, but you can have some gradual onset of symptoms. You can start a little bit. You may start having some fatigue, being tired all the time, can't figure out why you're just feeling so sluggish. And then sometimes you may have some swelling, and you may hear the doctor say edema, which means that you may have some swelling, not necessarily like in your ankles, but you may have generalized swelling, because remember now your blood has to be filtered. And if you're having some difficulties with that, then you may see swelling in your system. And sometimes you may see increase in your blood pressure. For some reason, your blood pressure is starting to elevate, and that's doing damage to your kidney. And if you go to the doctor may tell you that you have some protein in your urine. You may start having some nausea and vomiting. Now, these are sometimes that they're not things that's going to just pop out at you, but this can be over a period of time. You may notice that you're having a loss of appetite. And you may, even when you go to the doctor, you may even see that they may tell you that you're anemic, that your hematocrit and hemoglobin is low. So those are just some of the symptoms that you may distribute. And again, it may not be something that you just see, just outburst to see, but it may be something that when you go to your doctor, these things will start to sort of develop in your doctor's visit. That's why when you go to your doctor, you need to make sure that you're asking about your numbers, and that when your doctor tells you about your blood pressure, ask them, what is my blood pressure? What it is, how much do I have a different in my weight? Is my weight fluctuating? So know your numbers. And then we'll talk a little bit more about some of the lab work that you may possibly ask your physician for when you go to the doctor. So some of the tests that you could possibly have when you go for your checkup, and if the doctor is concerned about your kidney disease, some of the tests that you may have is, of course, we just talked about blood tests. So the doctor may be wanting, or your provider may be wanting to find out how to measure your kidney function. What is that kidney doing? How is it actually filtering the products out of your system, the things that need to be discarded? And so there are urine tests to check the protein in your urine. You want to make sure that that's not abnormal. So those are some of the things, some of the diagnostic tests that they can do. And even imaging testing, such as ultrasounds or MRI, are some of the things that they can actually do to look at your kidney as well. So then let's talk a little bit about the treatment. The treatment depends on the type of severity of the kidney disease. So that's when you're partnering with your provider to find out what stage you are, what is happening to the kidney, and being able to actually know what the plan will be. And that should be something that's discussed with you and your provider and your family, because this is Family Health Matters. You want to pull your family in on this discussion when you're talking to your doctor. So there may be medications that they look at, medications to control your blood pressure, to control your diabetes, or any underlying conditions. Remember, we talked about with chronic kidney disease that could be a cause, could be hypertension, could be diabetes, or some underlying cause. So you want to, first of all, try to treat those and get those under control. So that's why it goes back to the importance of knowing your numbers and also taking your medications. If your medications has been prescribed by your provider, you want to make sure that you're taking those medications. So if your provider tells you, they've diagnosed you with hypertension, then you need to take your medicine There's no need to go to the doctor or your provider, get a prescription. They've told you that you have hypertension or high blood pressure or even diabetes, and then you go get your prescription filled, and then you don't take your medicine. So you need to make sure that you take your medicine according to how it was prescribed. And don't get tired and decide that you're going to just stop taking it. And sometimes, even with your medications, what I'm talking about, that you can have different side effects, especially with blood pressure medicine. And it causes you to maybe have some symptoms or side effects that you don't like. And if that happens, then instead of just stop taking your medicine, then you need to actually talk to your provider about the medicine. Okay, Dr. Johnson, you back?
I hope so.
Can you hear me?
Tell me you can hear me.
Oh,
No.
uh,
Okay.
uh,
What about now? Nothing?
okay. All righty, we're
Okay.
gonna. No, don't go away. Keep trying, because I know you got some stuff you want to share. So keep trying. Can she talk on the phone? Call me. Just see if we can. You want to call me on the phone and then we can talk?
Yes, let's try that.
Okay. All righty. We're working on something, so you should be seeing something come up to you. Okay. But let me stay on track. Let's see. We were talking about the medications. Yes, treating the underlying conditions and making sure that you're gonna stay on your regimen with your provider. And it's important that you talk to your family members about your medications that you have. So if anything should happen, they will know what medications that you're taking, and then they'll be able to share those with your provider or with anybody that's in need of, if there's anybody who needs anything. Okay, say if you in a accident or something and somebody needs to know what medications you're on, you'll be able to share that with them. Okay, another treatment would be the possibility of having dialysis. Now, we had an episode, a show not too long ago where we talked about dialysis, and that's a procedure, just a reminder, but that's a procedure where you go in and you actually allow either the hemodialysis, which is the machine to actually filter the blood, or you can do what we call the peritoneal dialysis, where they actually put a catheter inside of your belly, and that does the same thing. It filters the blood. So that's another treatment that you can have. So you have medications, that's going to help control the underlying condition. And then you have the possibility of dialysis, which is going to do the same thing as your kidney does. It's going to filter out the waste from your blood. And then the last option is a kidney transplant. And that will depend on all the other underlying conditions or disease processes that you may have in your system. And your provider, along with the transplant team and your family, will all sit down and talk about the potential of having a kidney transplant. And that can be just a whole nother show all by itself. So we are going to look at having somebody come in and actually talk about transplant, not necessarily kidney transplant, but transplant as a whole. Okay, Sharon, try to call that number that just popped up on the screen. See
Okay.
if you can call, okay? And then maybe you can call in and talk. Okay. All righty. Let's see. Prevention. Let's talk a little bit about prevention. We've incorporated some of that into everything, but let's talk about prevention. Okay, Sharona, turn your volume down and talk through the phone. Now let's see what okay. Tell us about the complications. Can
So
you hear
talking
me?
about,
I know we got you jumping in the middle of the conversation.
yeah. So can you hear me? Are you able to hear me?
Okay. Um,
There's an echo.
yeah, it's because you're still on StreamYard. So just get off of StreamYard and just talk to us through the phone.
What
All
about
right.
now?
Can you hear me now, Sharona? Dr. Johnson?
Hello?
Hey.
Wendy? Okay. Can you hear me
Okay.
now?
I can hear you. Yes. Oh wow. See, the devil was just mad, but we're getting through this. We're getting through this. So,
Oh,
Dr. Johnson, could you hear a little bit of what I've been talking about?
yes, you did a very good job covering the different types of kidney disease, and you talked a little bit about the treatment modalities, transplant as one, and I think that is the basis of what I heard.
Okay. So you heard about the medications and dialysis, about the
Yes.
treatments. Okay.
Hmm.
Well, let's jump back a little bit. Can you share with us, as a provider, because you're actually a provider, that people often misses when we talk about, I just touched a little bit about the causes. So
Hmm.
we talked about diabetes, high blood pressure, and heart disease, but how does that specifically affect the kidneys?
Well, heart disease, specifically hypertension,
Uh-huh.
affects the kidney by it constricts the vessels, makes the vessels really small that go to the kidneys, and so it decreases the blood flow there, and over time, it can cause damage to the kidneys. That's probably the very simple way to explain it. And then for diabetes, just uncontrolled, specifically diabetes, is what can affect the kidneys just because of um, running really high blood sugars over time as well can affect the vessels that go to the kidney as well as the kidneys. Um, I mean, really, diabetes with uncontrolled diabetes. I don't want people to think just because you have diabetes that your kidneys are going to be affected, but it's very important to control your diabetes as well as controlling your high blood pressure.
Right, right, good. Because when we just talked about it, I just skimmed over. So that's good. Because those vessels are what feeds into the kidney.
Correct, yes.
Okay. Now I just a little bit talked about the chronic kidney disease and the acute kidney disease. Now I mentioned with the acute kidney injury is that it onset is really like quick. What it may be like a trauma or something that may have
Yes.
occurred. Anything else you want to add to that?
It could be trauma. I mean, sometimes athletes who are participating in races can experience acute kidney disease because they get dehydrated.
Oh,
Um, that's one aspect of it. I mean, of course, with trauma, blood loss definitely can contribute to kidney disease. And like you said, acute is something that comes on really sudden, but you can expect it to resolve very quickly as well.
okay. So that will be something, um, unlike chronic kidney disease, that over the process of long term will not resolve itself.
Correct. Chronic kidney disease, by definition, is kidney disease over a period of 3 months or more. We'll define or classify it based on the definitions we have nationally as chronic kidney disease.
Okay. Um, Now I mentioned about knowing your numbers. Now I know
Mhm.
we know about your glucose number, and we know that you should ask about your blood pressure, and you're looking at the verifying what your differences in your weight fluctuating or not. So what are the lab values that we should make sure that we're talking to our provider about that would reflect some type of either kidney disease or damage to our kidneys?
Well, we look at something called creatinine. Creatinine is a byproduct of our muscles breaking down, and it's usually excreted, or you basically pee it off.
Uh-huh.
So that number should be usually around the high value is 1. Anything less than 1 is usually really good. So it's best if you're going to your primary care physician or the provider you use not to focus so much on the numbers, but to ask, how are my kidneys?
Okay.
And they will be able to tell you just by looking at your lab work. And also, many of them will get a urine specimen or sample when you have your physical to be able to tell you, if your kidneys are okay, if there's something to be concerned about. So, I mean, I wouldn't get bogged down with the numbers, but I think
Okay.
it's very important at your physical to definitely ask your provider, how are my kidneys doing?
Okay, okay. So that's not, we shouldn't be telling them to actually about those numbers, but the other numbers like your blood pressure and those things, we need to make sure that we understand because that does have it does affect our kidneys, right?
Totally, yes. Your blood sugar, your blood pressure being controlled. I mean, I tell people who take blood pressure medicine to, keep a log of your blood pressures when you go to your provider to be able to show them kind of a trend of what your blood pressure is doing at home, and the same with your glucose levels.
Okay, okay, good, good. And bring those when you come see your provider, bring those with you,
Yes,
those results. Yeah, 'cause not any good if you have them and you leave them at home.
that's right. And it's good for us to look at trends, not just, people come to their doctor's office and they'll get in there and the blood pressure will be high. And so most physicians or providers will not adjust your medication based upon one reading. So it's important for you to bring it in so they can look at trends. Again, like I said, it's uncontrolled blood pressure that affects your kidneys.
Okay, okay. And so that's a good point because you can still you may have diabetes or hypertension, but it's controlled. That's the important fact of taking your medications or doing what you have, the plan that you and your provider have set for yourself to make sure that it stays under control.
Correct.
Okay, let me add. This is one question that was given to me. That was, what can I do to protect my kidneys?
So there's a few things. So if you, again, as we've already mentioned, focus on controlling your blood sugars, focus on controlling your blood pressure. We do ask our patients to exercise, to try to eat a balanced, healthy diet. A lot of people, especially the ones that have diabetes and kidney disease, it gets really, really tough to figure out what to eat. And so many of our offices have dietitians, or you can talk to a dietitian about some things that you can eat to make sure that you're eating a healthy, balanced diet. We want you to avoid salt. A lot of salt in the diet is definitely not good for you or your kidneys. It's important to stay hydrated and not with Pepsi or sweet tea, but water, very important. And then we tell our patients to avoid there's a class of drugs called NSAIDs. And NSAIDs include things like Motrin, BC powder, Advil. Not saying that you can't take those for a short period of time, but over long periods of time, they can actually damage your kidneys.
Okay, good, good. That's really because if you got to protect what you have. You have to make sure you protect that. Good. Now, this was another question, and I was saving these because I was hoping you were going. Somebody asked, "What's the difference between your provider, a family provider, and a nephrologist?"
So family providers or family practice doctors or your NP or your PA, whoever you see, they usually will monitor you from being a child all the way to being elderly. So from birth until death is when your family physician is there for you, and they're able to handle many of the general type illnesses that will occur over the lifetime of your life. So we have specialists. So just like you have a specialist, a stomach specialist, you have a heart specialist, you also have a kidney specialist. And the kidney specialists are called nephrologists. Okay. And so we usually ask our family practice doctors or providers to refer patients to our nephrology clinic when somebody has chronic kidney disease, just so that we can go ahead and assess the cause and try to make sure that they are not on things that will damage their kidneys further. Some people only need to see a nephrologist once, and then there's some that see us quite often. It depends on the degree of kidney damage that you have.
Okay, good question. Now, you kept mentioning about making sure you stay hydrated. So what does becoming dehydrated do to your kidneys?
Our kidneys really like fluid. And so in order to keep your kidneys in good working condition, it's important that you we say drink water or things that will help hydrate you. Pepsi, sweet tea, and all of those, believe it or not, can lead to some dehydration because they'll make you basically pee more, and the sugar in sweet tea obviously does not help diabetes, but also can be kind of an agent that can draw in fluid and make you pee it off. And so you can really end up being dehydrated from drinking a lot of sweet tea, and most people don't realize that. So in order for the fluids to be able to function like they need to in our bodies, we must keep them hydrated. If they become dehydrated, they are not able to perform at their best, and eventually over time, dehydration can lead to injury, hopefully acute, something that we can fix right away. But if it continues to be stages of not drinking and leading to more dehydration, those multiple acute injuries can eventually lead to chronic kidney disease.
All right, Dr. Johnson, thank you so much. We're running out of time, but thank you for joining us. And I'm so sorry about the difficulties, but we got that in and we got some very good information. So I just want to say thank you out there to the listening audience. And again, I'm your host, Wendy Bridgers. We're here on Awesome Radio every Thursday from 3 to 3:30. Have a great afternoon, everybody. Thank you, Dr. Johnson.
You're welcome.
Hello to